ought to be that workers' compensation costs are no longer a reason cited by my members when they're looking to move somewhere else in the country to be competitive. That ought to be our goal. Not to diminish the benefits to the worker, not to make it less or more expensive, not to try to pick out a bogey like the insurers to pick on in that regard. Let's get the system moderated back to the middle of the pack so it's not being utilized as that reason for leaving.
Thank you.
Representative Batnick.
Thank you, Mr. Speaker. Some of my questions were answered in the multiple other questions asked, but I want to go back to what Representative Tepetti was talking about a little bit, about the friction in the system. Do you have any data on the length of time, because this is something that's been repeated, witness after witness, of the length of time of getting claims settled in our state versus other states? Because I can tell you I've heard it today. I've heard it from business leaders in the community. We've heard it several times. So how do we compare with other states in terms of the speed that we get our claims complete?
You know, Representative, I don't have the comparison. What I can tell you I know from the 2011 reforms is it seemed to take about 18 months prospectively for those cases to work through arbitration commission and maybe to the court, but I don't have a comparison between Illinois and other states.
Some of the states, though, that do have systems, mediation services that try to keep it from getting into the arbitration system that we have to try to settle claims to get those kind of answers more quickly. Oregon, as an example, back in the 90s when this discussion was going on, had a system like that. It didn't seem to improve the speed of which you got people taken care of and back to work.
Okay, thank you very much.
Representative Amons.
Thank you, Mr. Speaker. I have one very quick question. Looking at the Illinois Manufacturers Association, I really appreciate you all being here for this. Caterpillar is an interesting scenario. I would like to see if you guys have looked at around workers' compensation, because their home base is in Canada, and Canada's medical system is different from ours. Have you all looked at that?
Did you mention Caterpillar?
Caterpillar? Is it
Home
Caterpillar?
base, Caterpillar is based in Peoria.
Peoria. Do you have any companies whose home base is in Canada where the healthcare system is different?
Not that I recall. I'd have to go back and check, but I do know two things that Caterpillar has said to us, and I don't know all of their cases, but certainly the three reforms that we've talked about today, they strongly support, and they also have told us they have an engine facility in Illinois, very similar one in Indiana. And as Greg said, a double carpal tunnel is 6 to 7 times more expensive in Indiana than it is in Illinois.
I wonder if we took a minute to look at some other countries' medical systems. That in our country we have high costs, 300, 400 times over what Medicare is when it comes to workers' compensation issues, which I think may drive up the costs. But we haven't done any significant real reforms when we look at the medical impact on workers' compensation. Have you all looked at that at all?
Well, in terms of the medical, in 2011 we did, and that's why we reduced the fee schedule. But I'm not familiar, again, with Canada, either their healthcare or their workers' comp system and how they work together.
I'll look for a study for that, but I appreciate you. Thank you.
Representative Sandak.
Thank you, Mr. Chairman. I appreciate it. Gentlemen, thanks for your indulgence. I'm going to stand because I've been sitting far too long. I don't know how you're so patient. I don't know, Greg, I don't know you heard every witness, but a lot of the prior testimony, all compelling and very moving, dealt with people in the system, some within Illinois' workers' comp system, some within Indiana, some within Oklahoma. And we've had a gentleman that's not sitting next to you talk about Indiana's workers' compensation scenario. Are you aware of any desire by this administration or by your organization to move Illinois towards an Indiana-like workers' compensation scenario?
Well, I guess to move toward it, I guess, no, we're not looking to be Indiana. It's a different culture, different state, different wage base, that kind of situation. What we're looking for is a fairness in the system to move to more middle of the pack so that, as I said, I think to Representative Wheeler's question, so that workers' comp gets taken off the #1 priority that my members say every time we ask them about why they don't like doing business in Illinois. That's the #1 reason. So let's work toward that.
And with that in mind, because I was around in 2011, 2012, when we did the reforms, which made some progress, and that was a good thing, but we haven't moved the needle very far. We're still a highly uncompetitive state when it comes to business expense that's allocated towards workers' compensation, premiums, and insurance. Isn't that right?
It is, that is correct, sir. Yes.
And what I'd like is there a model or an illustrative small business scenario that you've heard from your members? Maybe unfortunate, maybe it's caused you to lose a member and another state to pick up a member. A loss of business that's been predicated on being able to get a better return on value and a fair workers' compensation system so that a business left Illinois and went somewhere else, because this was a motivating factor, if you will.
Yeah, Representative, there's a number. Greg talked about a company recently. There was a shingle company in Jacksonville that went to Missouri. Modern Drop Forge in Blue Island left a couple hundred jobs and took it to Indiana. So it happens, unfortunately, on a somewhat regular basis.
And how often do you hear from your members that this is, and Greg, you said it's the #1 issue. How tiring are you here, is it for your members to continually go to you and say, when are we going to get relief?
All the time, all the time. Representative, as you know, this has just been a thorn in the side of the business community for many, many years.
And to another point, you're asking Illinois to be in the middle. You're not asking us to be an outlier, a polar outlier from where we are right now. You're saying, let's just get in the middle. Let's be fair to workers, unquestionably, but let's be fair to employers as well.
Correct, correct.
And to that extent, is your organization's working with this administration towards reforms that would do just that?
Yes, yes, we are.
One of my colleagues asked you about Attorney General Lisa Madigan's opinion on this. This is hurting the state of Illinois directly as an employer as well, is it not?
Absolutely. I forget what's the number the state pays annualized.
Yeah, I mean, tens and tens of millions of dollars, not only the state, but local governments as well. This is not just a private sector issue.
So we're getting whacked in a double way. Our private sector employers, the folks that we lean on to create jobs, pay taxes, create wealth, and hopefully pay for public services, getting hit, but so the state is too, directly as an employer.
You recall the Menard situation, to where you had a lawyer involved, you had a doctor involved, and you had a local officials involved in the Menard prison. People were getting the carpal tunnel payments by the dozens.
I do. It was outrageous, actually.
Right.
One more point, and I think a colleague of mine, Representative Wheeler, talked about it. People like to demonize the insurance industry. Are we going to demonize self-insured employers too? Because some of the reforms we're talking about are for employers that take care of their employees in a self-insured, self-managed plan. They want to see savings occur so that they can take care of their employees.
Absolutely.
What percentage of self-managed plans are out there right now, if you know?
I think there are hundreds in the state that represent, hundreds of thousands of employees.
Well, thank you for your patience. Thank you for being here. Thank you for adding some statistics and some illustrations to bring some balance. Mr. Chairman, I want to thank you for your indulgence. I do have to ask you, my leader asked early on about the length of this extent. I can't help but notice that many people have left. Is it still your intent to plow ahead and finish this all in one day?
Yes.
All right. Then I ask one more indulgence. Gentlemen, can you answer one more question? When were you invited literally to the table to testify today?
We were notified that this was in the works, a week ago or so, that this was coming. And Thursday night we were called and asked if we would appear.
Thank you. I appreciate that. And Mr. Chairman, Godspeed in your endeavors to try and get this done in one night.
Yes. Well, I could use a little help here. Thank you. Yeah, we're done.
Thank you, folks.
The next, I cracked myself up. The next panel is Karen Keep, who was injured on the job in Illinois, as well as Suzette Berkovic, who was injured in Indiana. And Chairman Corrigan will also return. Just for a note, it's my understanding that Ms. Keep has come down here and does have a plane to catch, so we're going to try and do her testimony as quickly as possible. Thank you. Ms. Keep, if you would proceed.
Okay. Good afternoon.
Good afternoon.
My name is Karen Keep. Thank you for allowing me to share my story. Due to time, I am going to kind of refer to my notes quite a bit so we can get through my story. Okay, this started 20 years ago. I am married, have 3 wonderful children, and July the 4th, I'll be married 40 years. I became a registered nurse in 1975. My husband was transferred every so often, and, well, actually quite a bit. And it was my choice that when he was transferred, I would take the challenge of learning a new field of nursing. So I have been lucky to work in oncology, the operating room, labor and delivery, pulmonary step-down unit, and same-day surgery. I also had the privilege of beginning an IV program at a major hospital. When my first son was born, I resigned from my position, thinking I was going to stay at home until he went off to first grade. I was at home for about 5 months, and I realized that nursing was an essential part of me, and I wanted to be there. I was injured in January 1995. I was working in same-day surgery at a major Chicago suburban hospital. I was working approximately 20 hours per week. My youngest son was nearing high school, and my other children were junior and senior in high school. I had already told my employer that I intended to go full-time when my youngest reached high school to start those college payments. I injured my leg when transferring a patient from a wheelchair to a surgical cart. The patient was falling, and I twisted my knee and felt a rip. My supervisor was present at the time, and while feeling pain and feeling it swell, I did finish my shift, but by the end of the shift, the swelling was so bad that I had trouble pulling off scrub pants, and we all know those are quite big. In April, I underwent knee surgery for a meniscal tear. I had damage to my ACL, and after surgery, I had swelling and pain in my knee, and within a month, I began experiencing burning sensations. I returned to limited duties, but the doctor took me off work again and had a second surgery in December. After the second surgery, the pain and swelling persisted. The burning sensations spread to other parts of my leg. I began to experience temperature changes. My left leg was 2 degrees colder than the rest of my body, and color changes in my left leg. I was diagnosed with RSD, reflex sympathetic dystrophy, or known now as complex regional pain syndrome, or CREPS or CRPS. 2 years after my injury, I was ultimately able to choose a doctor of my choice and who was recognized as an expert in his field. And I had multiple injections, blocks, and we're talking in the range of 60s treatments over this time period, trying to get better, just trying to get back to work. I also saw a psychologist to help me cope with the pain. I was able to return to sedentary work in September of 1998. excuse me. I was placed in pre-admission testing, which was a more sedentary job. I did not have direct contact anymore with patients. I spoke to them on the phone. But I still considered it a challenge to make sure that each patient was properly ready for surgery. My case went to hearing in 1998. Notwithstanding the facts that a doctor hired by my employer stated I did not have anything wrong with me. And the Workmen's Compensation Commission at that time ruled in my favor and awarded my medical charges, lost time, and 35% loss of use of a person. I continued treatment with my doctors and working in pre-admission testing. By the year 2000, my pain and my symptoms were spreading, and I could no longer do the job any longer. I was taken off work and underwent implant of spinal cord stimulator. I had to have this repeated 2 more times. Batteries break, wires break. My employer at that time said there was no nursing position available for me. They tried to place me in a non-nursing position, which was a registration or a clerk at the admitting desk. And I didn't even know how to type very well. I was a nurse. By this time, the spinal cord stimulator was not providing relief, or it had broken, and my doctor recommended a pain pump. This was denied, and again, I had to go before the Workmen's Compensation Commission. The commission again ruled in my favor and awarded me lost time and ordered my employee to pay for the implantation of the pain pump. I was awarded permanent total disability based on my doctor's testimony. I continue with constant pain and require ongoing medication and care. The pain pump has allowed me to manage my pain, though, much better. Before the pump, I could not shower, I could not bathe, I could not stand a fan hitting my leg. I had a tent built for the sheets on my bed. I continue to sleep very poorly. 4 to 5 hours is about all I get. I try to be as active as I can, and the medication makes it difficult to concentrate. That's kind of why I'm reading. Prior to pain pumps, I was admitted to the hospital for 3 days of inpatient psychological treatment. My girlfriends came over, and they took me in. I also continued on medication for that condition. My condition has had a significant, just a second, I'll take a breath. Has had a significant change in my family. When my children were younger, we had to accommodate their schedules and to accommodate my condition. Many times in the past, my husband had used his vacation time, personal time, to drive me to medical appointments and procedures. If my treatment had been stopped by Workmen's Compensation in Illinois had not ruled in my favor, I would not have this pain pump that helps me control the pain so much better every day. These awards have allowed me to continue my treatment. If the workers' compensation system had not ruled in my favor, I'd been left with a doctor who did not want to take on a patient with workman's comp, or no doctor at all. It's not easy being on workman's compensation. Many doctors do refuse you, and that is concerning. I have been told that if I would have gotten, now this is really important to me, if I would have gotten to my treating doctor early on, like in the first 6 months, it took me 2 years to get to him. They said I could have been cured. So I think that's really important. If you're thinking of making some changes, is get the patient to where they need to be. I still struggle every day, but my Illinois workers' compensation benefits allow me to try to live each day fully. This is my story. It can happen to you. Just a simple torn meniscus in a knee that turned into a nightmare. Thank you.
Thank you, Ms. Keep. Ms. Berkovic.
Hello, my name is Suzette Berkevich, and I thank you for giving me the opportunity to speak here today. I am a nurse as well, and I'm a staff nurse. I do direct patient care in a facility in Indiana. I injured myself on May 10th of last year.
Thank you.
And basically what happened to me was I was going down the hall with a medication cart, and there was another patient coming up in a motorized scooter, and I was kind of in the way, so I asked them to wait a minute while I pushed the cart out of the way and ran over my right foot, and immediately felt a lot of pain and discomfort, carried on with my medication pass, and afterwards I sat down at the nurse's desk and realized that my foot was really injured, and immediately contacted the supervisor on call. She said that there wasn't enough staff for me to leave at that time, so I had to finish my shift and then went to med check, which is where they send their workman's comp or injured workers to. When I went there, I was seen by a physician there who told me that I had a contusion and to ice it and elevate it and go about my day. So I went back to work, was treated, kept going back to the med check because my foot was getting worse. It was swelling, it was tender, I could barely walk on it. Basically, after going several times, I ended up having had to go for an MRI, rule out a blood clot. With the MRI, it showed that I had a large hemorrhagic hematoma with a bone growth that was pushing on the nerve in my foot from the trauma of the injury. This is a month later from injury. When they finally sent me to an orthopedic doctor, the minute he touched my foot, he knew exactly what was wrong with me. He said, "You have RSD." But the problem with treating it at this point to do the surgery to remove bone growth in the hematoma was that I had RSD, and it was very flared up, and it was not a good idea to go into surgery at that point. We did try sympathetic nerve blocks. We tried different medications, Lyrica, trazodone, pain medication, and unfortunately I could only take Percocet because I'm allergic to every other pain medication out there. So it was either the Percocet or the Tylenol Extra Strength. I eventually couldn't stand the pain from the nerve pushing down, and they went ahead and said, we're going to go ahead and do surgery. I then had to have a spinal block, and then I had a pain pump that was placed under my knee so that I could come home to control the RSD pain. And then from that point on, I still got sympathetic blocks that never helped. I was basically ended up to where the point I am now is therapy and everything failed, and I had a spinal cord stimulator placed 8 weeks ago. And I've actually gotten some relief from that. It has not got rid of my pain by any means, but it's tolerable enough to where I can bear weight and start trying to get back to myself. Just recently, I was going to therapy, and I went back to my doctor a couple weeks ago, and they have decided that they don't want to pursue that I'm not going to get any better, and they're wanting to close my case, so I'm scheduled for an FCE. I've been down for about a year, and I'm definitely weak. I have atrophy in my right leg to foot. I have a permanent foot drop. I can't stabilize my right ankle, so I have to wear an AFO all the time. I have no feeling from my toes to this incision site, so I can't drive a car because I can't feel the pedal. It has definitely impacted my life. It has changed it completely. Normal things of just walking, I can no longer do. I can't wear normal shoes like everybody else. I have to wear one pair of shoes that I have to have ordered to fit my brace. It has taken a toll on my family and my life. I was receiving temporary disability checks at the maximum, and now those have stopped. I had to file bankruptcy 2 months ago because I was going, I have student loan debt from my education, and I can't put them in a forbearance or anything. I have to pay them. And with my other debt, I wasn't able to make the payments, so I filed bankruptcy, and it's not gone through completely yet. But I still have to pay the student loan debt. And it doesn't matter if I can't work as a nurse anymore or have a partial permanent disability. In Indiana, you're either just permanently disabled or you're not. And so I'm stuck in the middle, and I'm here to tell my story because in Indiana, you know, there's no options for me. I've been a nurse for 20 years. It's the only thing I know how to do. I did go back to school, worked full-time, went back to school full-time to get my education, and I can't even practice now in the field. I have a child that is young, and she has needs, and I'm not really sure what's going to happen from this point on. I don't know if I'm going to lose my home and everything I have. That's not a lot, but it's mine. And in Indiana, basically, you know, the compensation is capped, and even though I've lost my ability to work as a nurse, even if I was to be able to pass the FCE with doing desk work or doing minimum wage work, it doesn't compare to what I was making as a nurse and what my future would hold from that point on. I continue to have to take medication. It's just been a strain. It's been a financial strain and emotional strain. I rely on my husband 100% now. He had to pick me up on his insurance, and that's costing us a lot of money that we didn't have to pay before.
Suzette, thank you. In the interest of time, we have to kind of move on. I really appreciate your compelling testimony. Mr. Corden, your thoughts real briefly.
My brief thoughts, and they're somewhat a reiteration of what we said before, was the comparison between the two ladies with similar jobs, similar injuries. One is going to be receiving permanent total disability, that is Karen. And as Suzette said, she may find a job significantly lesser pay. Indiana does not have vocational rehabilitation provided by the state, and she probably has a reasonable expectation of finding some type of reasonable employment, as that is defined by the statutes of the state. And as such, she'll probably receive a permanent partial impairment award as opposed to a permanent total disability. Thank you.
Thank you. Questions, members? Representative Kifowit.
Thank you, Chairman. Just one question, as I hear from Mrs. Kipe and Mrs. Berkowitz. It was mentioned quite bluntly that if your condition had been treated sooner, you would not be in the condition you are today. And is that the same for you, Mrs. Berkowitz? If your condition had been treated properly sooner,
Yes.
Whose fault, do you see that as the fault of the insurance company administering the workman's comp, or more on the employer's side? Could you just elaborate briefly what the delay was in your treatment?
I felt like where they had sent me to get my care at the immediate care center, that the doctors there were not familiar with RSD, and they had never really had ever seen it before. So they were ruling out things, but it wasn't what it really was. And it wasn't until they sent me to a specialist that I feel like my care really started to take form, and they were actually trying to help me get back to myself.
My care, the reason it was delayed is I was sent to doctors that they chose, and the doctors that they chose, I was told, are repeatedly used for workman's comp evaluations, and I felt that he did not evaluate me at all. My leg was cold, it was purple, and he said there was nothing wrong with me. And it seemed to my employer, I was treated like they kept on going, you know, let's get you help, they're saying all this. And for the first 2 years, they seemed to be like they were gonna try to help me. I felt like they were trying. I did not get an attorney until they stopped. And at 2 years, see, there was a problem also that a cart had malfunctioned, and that, I mean, within 6 months, I saw that all the carts were placed in the hospital. But it's my understanding that after 2 years, you can't file. During that time, my goal was just to get better and get back to work. And I believed I could. Nobody said I had RSD until I got to 2 years later to the specialist I needed.
Representative Neckritz.
Thank you, Mr. Chairman. I'm over here. Ms. Keep, over here.
Okay.
Okay. Thank you for being here today, and thank you for telling your story. I want to, one of the discussions we have around here a lot around workers' compensation is this issue of employer's doctor versus your own doctor. So as I understood it, when you were first injured, you went to the employer's doctor, designated doctor?
The first thing I did was they told me I could see my family doctor. And I went, and they did the typical thing of, for a tear in the meniscus is what they felt. Testing wasn't done, but it was ice, elevate, and brace. And so then after that, it was discovered, then I think that testing was ordered, and then I did get to choose my surgeon, and this is before the burning all started in my leg. And so I went to my surgeon, and then the burning started in between the first and the second surgery. And it was at that point where it kept, you know, where I wasn't falling in the norm of post-op, and we knew something else was wrong when the pain had moved to my toes and on my left buttock. I mean, I couldn't sit in a chair. In the jobs they gave me in pre-admission testing, I had a chair without the arms on it, and one cheek on, one cheek off. So all these things were showing, and then all of a sudden they just kind of stopped. And so then we realized we needed to get some help, and we went to an attorney, and then that's when they started sending us more to their doctors.
Once you got the attorney, then you were sent to the employer's,
Right.
whoever your employer's doctor was.
And then it was get their opinion, and then nothing's wrong with you.
And then at what point, what point did you get to the specialist that actually recognized the symptoms?
Working in same-day surgery, I knew my surgeon quite well, and I went back to him, and he ordered some more testing, and he also ordered another pain doctor at that facility to see me and start some blocks. And then when those helped, then he said, you need to go, we're going to send you up to Mayo Clinic. And so he got me there, and then Mayo Clinic got me to my pain specialist in Chicago.
And were all those, at that point, were all those visits covered by the workers' compensation?
No, I guess I don't know who was paying at the time. That I knew they were being paid. I thought that it was through my employer, through health benefits, you know, that.
But you're not sure.
I'm not sure.
So you made one other statement about the doctors refusing workers' compensation patients. Did you have some experience with that? And what,
Yes.
And
currently, right now, I am.
okay. And how is that playing out?
Right now, my doctor has left. Well, I honestly don't know his situation. When I went to go see my doctor, I was told he was on administrative leave, and I received a letter from him, and he is not, and he is choosing to go somewhere else. So he said he referred me to a doctor that was in that practice until he resurfaces. So I'm kind of up in the air right now.
And just wanted, if you were not receiving the pain pump through the workers' compensation, what would your level of pain be?
Oh, I mean, even now, I get an electrical jolt that recently I was in church, and I gave a big, and they came and they blocked people away and were calling for help. It just grabs you. It's bad. It's really bad. I mean, I will tell you though, I have made every effort. My husband, we moved to Texas because he was transferred, and he put in a swimming pool. I have been doing water aerobics for 15 years, and that has kept me mobile. I, on my own, have done that, and no one is paying for that.
Right.
And
Well, I just want to say thank you for being here to tell your story, and it's
Yeah.
clearly a life-altering event. Thank you.
thank you.
Thank you as well. No further individuals seeking recognition. We'll move on to the next panel. Mr. Kevin Kite, who was injured on the job in Illinois.
Good for you. I just got one this morning. Wow, that's great. Great for you.
Thank you, Mr. Kite. We really thank you for your patience. Thank you for being here. Please put the microphone close and please proceed.
Should I speak?
Yes.
Before I go ahead, I've looked around the room quite a bit through the afternoon, and I noticed a lot of the House members joking around with each other and not really paying attention. And some of them aren't here now, so I hope you all pay attention. Good afternoon, members of the House of Representatives. My name is Kevin Kite. I'm 56 years old from Quincy, Illinois. The first thing you should know is that I suffered a massive head injury. On the job, as a result, I have significant difficulty with my memory. That's why I'm reading. When I explain my incident to you, it will be what I was told that happened to me by others. Because the fact is, I have no memory of what happened to me. In December '96, I was loaned to a wheel manufacturer as a metal press operator making wheel rims. The metal press I was working on kicked out a piece of metal which struck me over my left eye and forehead. I was immediately taken to the hospital where I received a number of surgeries to save my life from my injuries, including a massive frontal skull fracture which resulted in the loss of my left eye and severe brain injury. I was diagnosed with acute epidural hematoma, a massive skull fracture to the face and forehead, open brain injury, loss of consciousness, skull fracture, multiple intra-brain injuries, among other injuries. The left side of my skull has been indented, so doctors had to move it back out. I received rehabilitation treatment for about a month in early '97. I was then evaluated and diagnosed with dementia due to the head injury, head trauma, meaning I had lost some normal function in the areas of memory, communication, reasoning, understanding, problem solving, perception, and sensory abilities. I underwent a number of neuropsychological assessments, the first of which indicated that my IQ was probably reduced due to the injury. A doctor later stated he did not believe I could perform gainful employment at that time or any other time in the future because I had significant frontal lobe deficits. I would ultimately be found to be medically, permanently, and totally disabled from any and all gainful employment as a result of my injury and brain trauma. If I could go back to that day and have my life back, I would. Some people want to reduce the benefits of workers who suffered like I did. I don't want to be in this situation, and it was not my fault that I'm here today. What I want everyone to understand is that the compensation I receive for my injuries will never come close to making up for what happened to me. It will never be enough to feel as if I had been significantly and fairly compensated. Since my injury, I've experienced serious hardships. My short-term memory is so bad that I'll ask the same person the same question over and over. The effects of my injury are hard on me emotionally and psychologically. People are constantly asking me what happened to my eye and face. My doctor said there is no way I can go back to work and that I would never find gainful employment. I am financially responsible for my 15-year-old son who has autism. Aside from my oldest son who helps me out around the house and a Medicaid for my other son, I receive no other assistance. As a consequence of my injury, I only receive $287 a week from workers' compensation and $1,200 a month from Social Security. I'm not getting rich off this program, and I wish I could go back to my previous life. The little I receive in compensation is barely enough to get by. However, some people want to change the law so that if I were to have the same accident, I would receive even less assistance, further reducing assistance that is already tough to get by on would only serve to injure the victim twice. In this country and this state, we take care of each other at the time of our greatest need. I hope my story will show you the true face of what changes to the workers' compensation system would do and the impact it would have on the working families. Thank you.
Thank you, Mr. Kite, and thank you for your patience and indulgence. Chairman Corden?
I have no comments at this time.
Okay. Representative Cassidy for a question.
Thank you, Mr. Chairman. Mr. Kite, first of all, right over here to your right, in the purple. Hi. I want to apologize. I appreciate your frustration at the attention span issues in the room, and I apologize. I think
there's a lot of it.
You've got our attention,
Yeah.
and you certainly have mine.
Did anybody else have your attention?
Yes.
Because there was a lot of people speaking today in their testimony, and there's a lot of people laughing in here and joking around with
I hear
each
you.
other. And I know
I
where
hear you.
they're
And
at.
everyone's stories are valuable, and you're absolutely right.
Is it worthwhile for me to even come here?
I believe so, and I thank you. And I know that it was hard work to share your story, and I appreciate it. I think that what you've been through is exactly what we need to hear, and what you continue to go through with your low compensation, the issues with your sons. I think we all need to understand more clearly what we're dealing with as we talk about this. Do you receive ongoing medical treatments?
Oh, yeah.
Yeah.
I will for the rest of my life.
And does that take up a great deal of your time?
Yeah, none of it's in town. It's all, St. Louis, things like that.
And are you able to transport yourself?
Me, my family.
Your family helps you get there? And that, it sounds like it falls on your older son?
Yeah.
That assistance? Okay. It sounds to me, based on your description of your life before, you were a pretty independent guy.
Yes, I was.
I think you've shared with us, but what is it like to lose that level of independence, to be dependent on your son?
I've depended on them since I've had the accident, and it's hard. It's like being another kid because you can't remember things. You're always asking somebody something, and after a while, people get tired of that. And my oldest son was 11 at the time when I got hurt, and that shook him up pretty bad, and he's, everybody. It destroyed the whole family.
I can appreciate that. My father was injured when I was a young teen, had a major facial injury. Most people couldn't understand him. He was terribly disfigured. I had to speak for him a lot, so I get that. I get what your son's going through, and my thoughts and prayers are with all of you. What are some of the things you used to be able to do before your injury that you can't do today?
Like play baseball or football. I don't like When an object comes toward my face, it scares me to death.
Is it like a depth perception?
Mhm.
I think that we do need to understand that it's not just your ability to continue to work and earn a living, it's your ability to live a full and independent life. And,
Right.
I thank you for sharing that, as hard as it is. I really do appreciate you being here today.
Thank you.
Thank you.
Seeing no further questions, Mr. Kai, I really do appreciate you coming, and I assure you that your testimony has been taken seriously.
Let me go. Thanks. Thank you, Kevin.
We're going to have to go a little bit out of order because of individuals who have flights to catch. John Burton Jr., Professor Emeritus of School of Management and Labor Relations at Rutgers University, and Dr. Sumit Batra, who is an MD, Occupational Medicine, University of Illinois at Chicago. We'll begin with Mr. Burton, and we thank you for coming all the way here from Rutgers. Please proceed.
Well, somehow the airline yesterday canceled the flight from from Newark to Chicago, so they rerouted me through Boston. So it's a long way getting here, and I think it's going to be a long way getting home tonight. I really appreciate the opportunity to speak today about workers' compensation. As you heard, I'm emeritus professor at Rutgers University. At one time, I was on the faculty of the University of Chicago Business School. So I lived in Illinois for more than a decade. And in 1972, I was chairman of the National Commission on State Workmen's Compensation Laws, which submitted its report to the President and to the Congress in 1972. There's a statement that is being distributed, and I'm going to refer to it, and I'm not going to mention everything that's in the statement, but at least I'll give you the highlights of it. Workers' compensation national developments.
Mr. Burton, could you make sure you speak directly into the microphone?
I could do that.
There, thank you.
Right. Whoa, okay. As you all know, each state has its own workers' compensation programs, and these programs vary quite a bit, in part because there are no federal standards in workers' compensation. There are differences in benefit levels and compensability rules and a whole series of other things. We've had variations in the cost and the benefits in workers' compensation, and I've given you a figure. This is the professor of me coming through. You'll see a figure 1 which shows benefits and cost of workers' compensation since 1980. And just to summarize what's pretty obvious, I'm just glancing at figure 1, costs were going up until the early 90s and then substantially declined during the 1990s and have essentially fluctuated at a fairly low level in a certain sense for the last decade or so. Cost and benefits as a percentage of payroll nationally are currently at close to their all-time, to their lows since 1980. There's another figure I've put in here because it helps explain some of the decline in workers' compensation costs. This is figure 2. These are data from the National Council on Compensation Insurance, which you're familiar with, having heard references to it several times today. They do an annual evaluation of the impact on premiums from statutory changes in benefits. And you'll see in this figure 2 that there's been a substantial variation over time in what states have been doing. In the 1970s, benefits were going up substantially, went up, in fact, over 50% in the 1970s. The 80s, they were pretty much marking time. In the last couple of decades, for the first time, I think certainly since the 50s, we've actually had decades in which workers' compensation statutory levels of benefits have declined. And of course, one of the consequences of that is a state that doesn't change its law tends to become more expensive relative to the national average. And this is part of what is a concern of many people about workers' compensation. These changes since 1990 have been due to several factors. In some jurisdictions, the weekly benefit amounts or the duration of cash benefits have been scaled back. But these reductions in statutory levels of benefits do not explain all of these declines. A good deal of the changes are due to limiting the compensability of claims involving particular medical diagnoses such as carpal tunnel syndrome, limits on coverage when the injury aggravates a pre-existing condition, and procedural and evidentiary changes such as requiring objective medical evidence and imposing a stricter burden of proof on workers. One of the eligibility requirements that has been introduced into workers' compensation in the last several decades includes the major contributing cause doctrine, which was introduced along with some other reforms into Oregon in the early 1990s. And the consequences of those changes in the Oregon law, including the MCC requirement, were to reduce benefits and cost by about 25%. Now, some of the workers who are displaced from workers' compensation programs by the changes in these compensability rules end up in the Social Security system. But as I explained here in a paragraph I won't bother to read through today, on page 4, there are limitations on the benefits that Social Security disability insurance provides for people who are squeezed out of workers' compensation. One of the most obvious ones being that the largest category of benefits in workers' comp is permanent partial disability, whereas the SSDI program is pretty much limited to total disability. Section 3, I took a look at some of the recent developments in Illinois, and you were certainly in this room more expert on these than I, but I did summarize them. And then on pages 4 and 5, I tried to pull together some data indicating what has happened as a result of these changes in the 2011 statute here in Illinois. One of the complications is that it takes a long time for these changes to work their way through the system. And so we're still seeing that process, and I mentioned the fact that the NCCI itself originally estimated the cost savings would be relatively small, but in subsequent years, their actual experience with the law led them to make substantial reductions in benefit levels. Another source of data is the National Academy of Social Insurance. This is an organization that I've been involved with, and including the preparation of the benefit reports that are referred to here. And this NACI data indicates that, in fact, the intended effect of the 2011 reforms on benefits were successful. For the 5 years from 2008 to 2012, which is the last year that NACI currently has data, total workers' compensation benefits declined by 9% in Illinois, which means that in terms of comparisons, Illinois ranked 44th out of 51 in terms of cost or benefit payments. That is, we being Illinois, were close to the bottom in terms of what was happening to benefit increases. There's also information on cost in the NACI data, and again, the data here are spelled out for you, but essentially you'll see that between 2008 and 2012, employers' costs declined by 11 cents per $100 of payroll, compared to a national average decline of 3 cents. So There are other ways of measuring this. The Oregon Department of Labor, we've heard some references already to their premium rankings. Illinois has improved its ranking there as well. I might note that one of their findings was that the net decline in voluntary premium payments from 2010 to 2014, Illinois had the 11th largest decline. That is, only 10 other states had a larger decline in net premiums during that period. Finally, at the bottom of page 5, I mentioned some very rough comparisons on what's going on in the insurance industry in Illinois, and essentially it says that profitability in Illinois, once you take into account investment earnings, it's been a profitable state. It's about the national average. So I would say, in summary, at the bottom of, at the end of section 2, the essence of this review is that this, subsequent to the 2011 amendments to the Illinois Workers' Compensation Statute, benefits for workers and costs to employers have declined relative to benefits and costs in other states, while the profitability of the Illinois workers' compensation insurance industry is close to the national average. Final section is one in which I talk about the proposed reforms that Governor Rauner has included in his document on reform, and I list several of them that are mentioned there, but I want to focus in on one that's had a lot of discussion today, and that is the proposed change in the, it says compensation standard, and it should be causation standard, and I repeat the language that is in the governor's proposal. And the governor's discussion of this indicates that several states have recently passed these laws requiring the workplace to be the primary cause for workers' compensation to be compensable, and indicating that Florida's major contributing cause is identical to the one proposing. I have some concern about the governor's history because it is, by my standards, truncated. The requirement for the first state I know of that introduced the major contributing cause doctrine or compensability standard was Oregon. And as I've already indicated, it led to about a 25%, it and some other changes led to about a 25% decline in benefits paid to workers and costs to employers. So that when I've heard the description today that there's nothing proposed by the governor that would reduce benefits, that presumably doesn't make sense because that's the whole purpose of this standard, is to reduce benefits. Now, it may be that the weekly amount for persons to get into the system is not changed, but the bottom line is that this major contributing cause standard will, in fact, keep a number of workers out of the workers' compensation system. There's another part of the MCCI standard which was not discussed at all in the governor's language, and it's kind of interesting. It came up a little bit in the previous discussion here. And here's a little history on workers' compensation, which you've heard some of already today. If you go back to 1900 or so, prior to workers' compensation laws, workers who were injured on the job had the right to sue their employer in tort suits. Now, they weren't generally successful, but that was a right, and when workers were successful, they could get substantial rewards. When workers' compensation was introduced beginning in New Jersey, not Wisconsin, incidentally. New Jersey was the first state to pass a law that has withstood a constitutional challenge. That's a little parochialism coming through there. The changes included reduction in benefits in the sense that you no longer could get the tort recoveries. That's one thing employers got. The other thing employers got was workers' compensation became the exclusive remedy. You no longer could sue the employer in a common law suit. Now, what employees got was a no-fault system, which made it a whole lot easier for workers to get workers' comp benefits than it was to win tort suits. Now, the question is, and this is a first full paragraph on page 7, given this historical feature, these historical features of the workers' comp principle, a current issue is, can a state pass a statute that both, one, contains requirements that make it impossible for a worker to qualify for workers' compensation benefits, such as the MCC clause, and two, contains provisions that preclude the worker from bringing a tort suit by stating that the workers' compensation is exclusive remedy for the workplace injury. In essence, can there be a dual denial of both workers' compensation and tort remedies? Now, it was interesting that one of the previous speakers said, what happens, somebody asked the question, what happens to somebody if they don't qualify under the new proposed law in Illinois? And he actually said, well, they could go to common law, go bring a court suit. That's not what's behind this proposal, because the way these things have been introduced in other states, it is to include a dual denial. You cannot bring a workers' comp suit and you cannot bring a tort suit. If that's not the purpose of it, which I would be very surprised, then I think it's a much different kind of proposal. And I trace through here what happened in Oregon when they put the major contributing cause standard into effect. The Supreme Court at Oregon first said, well, as we interpret the statute, it must mean that if you can't bring a workers' comp claim anymore for these cases which don't satisfy the MCC, a major contributing cause standard, you have a right to bring a workers' comp claim. So the Oregon legislature went back and says, no, that's not what we meant. What we meant is, if you don't meet the MCC standard, you cannot bring a workers' comp claim and you cannot bring a tort suit. The Oregon Supreme Court's response to that was, that is unconstitutional. You cannot take away both. You cannot take away the tort remedy without providing an adequate substitute. Now, there are some other states that have essentially had dual denials, which have been upheld, but I've got a note here indicating that this is a challenge that's going on in a number of states. Incidentally, there's also a Pennsylvania case here that kind of goes back to the other issue. Supposing you have a statute that precludes workers' compensation because, in this case, of exposure limits, can you preclude the worker from bringing a tort suit? And the Pennsylvania Supreme Court said, in a recent case, 2013, there's no way you can deny a right to tort suits if the worker doesn't have a right to bring a workers' comp claim. So, and I quote the language from the Pennsylvania Supreme Court at the top of page 8 of my remarks here. So the essence of this brief excursion into challenge to the dual denial doctrine is that, at least in my opinion, there's a significant risk that the adoption of this approach in Illinois will result in challenges to the exclusive remedy provision that makes Illinois employers susceptible to tort suits for work injuries that are no longer eligible for workers' compensation benefits. This surely qualifies as an unintended consequence of the effect to make Illinois more competitive in order to increase jobs and grow the economy. And it's a risk that I don't think certainly has not been mentioned in anything I've seen that's come out of the governor's office. Now, I don't want to overstate this. I'm not saying it's necessarily unconstitutional, but all I'm saying is we now have decisions in several states, and there's another case in the footnotes talk about in Florida, which even takes this constitutional issue a further step. You are taking a risk if you scale back benefits or limit compensability, that the exclusive remedy provision that employers rely upon to avoid tort suits will be struck down by the courts. So in conclusion, I'm saying Illinois made significant changes in 2011. They are working their way through the system. They have improved Illinois' position in terms of benefits and costs to other states. I say there's more that can be done, but we ought to at least give credit to what has happened, is that Illinois has been benefiting from those changes. And secondly, as I've heard described today, one of the major components of the governor's proposed reform, I heard it described as one of the three pillars, I guess, of the reform, is this compensability standard. Well, just to repeat myself, that compensability standard is going to take a fair number of workers out of the system. Now, whether you want to call that a reduction in benefits or not, I would. The workers that are still in the system may get the benefits, but a lot of workers will no longer be eligible for workers' comp. And secondly, to the extent that provision is in the statute, it jeopardizes the exclusive remedy provision that employers rely upon in this state. So there's more in this, but that ought to give you a flavor of this, and I suspect I'll get a few questions or comments as a result of these remarks. Thank you.
Thank you, Professor Burton. We're going to hear next from Dr. Samit Batra, Occupational Medicine Department, University of Illinois at Chicago, and then we're going to entertain questions for the entire panel. Dr. Batra.
Good afternoon. My name is Samit Batra, and I'm a physician about to complete specialty training in occupational medicine at the University of Illinois at Chicago. Today, I'm speaking on behalf of Dr. Linda Forst. Dr. Forst is a physician, professor, and the head of the Division of Environmental and Occupational Health Sciences at the University of Illinois School of Public Health. She is board certified in occupational medicine and internal medicine. She has treated patients for work-related injuries and illnesses for over 30 years. She conducts research to detect and prevent injuries in high-risk working populations and to evaluate the use of impairment ratings. Dr. Forst was unfortunately unable to be here today as she is out of state at a national occupational medicine conference, and I have come here today to give her testimony. A few years back, a man came into the ER of a public hospital in Chicago with a meat grinder encasing his hand. When asked whether his injury was work-related, he said that it was not. After surgery to completely remove the hand, the man was discharged. Around a year later, he was seen at a different hospital being treated for suicidal thoughts. He had been fired from the job where the hand injury had occurred. He had not received workers' compensation to cover medical care, time lost, or permanent partial disability. He did not receive job retraining. He was a single young man and was living with friends because he had no way to pay the rent. It is very likely that the hospital, the worker himself, or taxpayers in the state paid his medical bills. It is unlikely that the workers' compensation insurer for his employer knew anything about the case, and therefore it is unlikely that the employer experienced any negative consequences of this injury. In another ER at a university hospital in Chicago, a man came in with a degloving injury of the fingers. That is, all the skin, fat, and muscle was ripped off several fingers, and all that was left were bones, ligaments, and tendons. This patient did not speak English, and his boss accompanied him to the ER to serve as a translator. At first, he denied that the injury occurred at work. On careful questioning, it was discovered that this man's fingers were trapped in the rollers of a printing machine. This man underwent extensive surgery to save his fingers. I do not know what happened to him in terms of work, payment of medical bills, or job retraining. I do know that he could not have possibly ended up with complete use of his hand. In 2012, there were 146 work-related fatalities in Illinois, and in 2013, there were 176, 30 more deaths than recorded just a year before. Despite the reported downward trend of occupational injuries, when we look at the most severe injuries and we get reports from hospital rather than from employers, the number and rates of injuries have actually flatlined. The rates are unchanged and not decreasing over the past decade. Furthermore, there are certain groups of workers, minorities, immigrants, and those that are contingently employed through temp agencies or in residential construction who are getting severely injured and dying much more commonly than other groups. In other words, there are health disparities in work-related injuries in Illinois, just as we're seeing health disparities in cancer, diabetes, and other chronic disease. There is a dangerous perspective growing among our elected officials that health and safety constraints are bad for the economy, that workers' comp insurance premiums and payouts are bad for business, that reduction in payments for employers mean that no one is paying for these injuries. There is so much evidence to the contrary that it's mind-boggling that anyone could hold these opinions. Furthermore, all efforts to make workers and taxpayers carry the burden of occupational injuries while protecting employers calls fairness into question. What do I think we should do to reduce costs? Number one, the most obvious way is to prevent injuries. If employers comply with the law, if they guard machinery, if they require fall protection, if they train workers to recognize hazards and take precautions, injuries won't happen. It's a no-brainer. Prevention is good for employers, it's good for workers, and it's good for the economy. Prevention should be tied to any effort at workers' compensation reform in Illinois. Number two, it's important to understand how, where, and why occupational injuries are occurring. We need a system for assembling data so that we can narrow our focus on industries, work processes, employers, and workforces that have the highest risks. Data management, data analysis, and data sharing are critical. Currently, Illinois has many agencies that collect data. These include the Workers' Comp Commission, the Department of Insurance, the Department of Labor, state health departments, and private and public healthcare systems, which are amassing information on occupational injuries and illnesses all the time. All of this data should be exploited and brought to bear on understanding the problems and targeting actions to reduce workplace injuries and illnesses. We need to get our data sources in order in this state and require our state agencies to share data with each other and with the public. It is my opinion that focusing on a tiny piece of the workers' compensation puzzle will only exacerbate rather than solve the problem it's trying to address. We need to look for a comprehensive and systemic solution. We need to make Illinois workplaces the safest in the nation, and this is the best way to reduce workers' compensation costs. Thank you.
Chair recognizes Representative Welch.
I think I'm the easiest legislator to spot today. Thank you both for being here today. I have questions for Professor Burton. A couple of weeks ago, the governor gave a few legislators who met with him his Illinois turnaround proposals. And I've actually read it a couple of different times. The workers' compensation area, I'm certainly not an expert in, so I've really appreciated your testimony here this afternoon. I actually had 3 questions that I wanted to ask someone, and based on your testimony, I think you're the guy. Yes. In the proposals, the governor says that he wants to change our standard, and you've kind of touched on that. Illinois has an any cause standard. And if we change from any cause to a major contributing cause standard and require the work accident to be more than 50% responsible, would this change benefit the employer or the employee?
The employer.
In what way?
Well, it would reduce costs. It's going to eliminate a number of cases from qualifying for workers' compensation benefits. And then, you know, if you don't pay benefits, your costs go down. That's the bottom line. Incidentally, I have that document. In fact, that's what I quoted from in my you'll see I haven't downloaded it and so on. So yes.
I also note in the proposal that he points out that Illinois allows the commission to use only one of 5 factors to determine PPD. And yes. He wants to change it to allow for the commission to base the award solely on AMA guidelines.
Yes.
If we were to make that change, would that benefit the employer or the employee?
I presume it would benefit the employer in most cases. Let me a little bit elaborate on that, because that's not in my paper, but I am familiar with this argument. One of the questions we have about workers' compensation is, what is the purpose of permanent partial disability benefits? And although there is some disagreement on this issue, I think most persons have said that it is to compensate for work disability, that is loss of earnings or loss of earning capacity. Okay. The AMA guides to the evaluation of permanent impairment only look at impairment, the medical consequences of the injury. For many workers, the impairment may not be as important as some of these other factors in determining the extent of disability. If you're uneducated, if you're old, whatever, this very same injury to you may have different consequences than it does to me. And so taking into account some of these other factors, I think, gives a better chance for the system to come closer to recognizing the true economic consequences of the injury. Now, there are some states, let's just put this in a national perspective. There are some states now, and New Jersey happens to be one of them where I'm from, that essentially only base permanent partial disability benefits on impairment. There's no adjustments made for these other factors at all. The proposal from the governor does not go that far. It only says you can, if you want to, base the decision strictly on impairment. In general, I think the ratings one gets by looking at these other factors, age, occupation, and so on, the other factors that are present in your law tend to increase the rating, so that to the extent a judge would pick up the thing and say, we're only going to use impairments, it's probably going to reduce the benefits. Now, again, Illinois isn't like some other states which say the only thing you look at is impairment, but it is giving an opportunity to use only impairments if, as I understand the proposal here, would be up to the individual arbitrator or judge to make that decision.
And the last question, Professor, is I note in the proposal as well, it's pointed out that Illinois limits a commissioner to only considering a treating physician's medical records. The proposal would change that to allow a commissioner to review both a treating physician's medical records and an independent medical examiner's records. Would that type of change benefit the employer or the employee?
Well, I think it would probably benefit the employer in the sense that a treating physician is probably going to be more sympathetic to a worker, because realistically the other doctors that are likely to be involved in this thing are going to be somebody that the insurance industry, the insurance company or the employer gets an independent examiner who is in fact hired by that employer and more likely to make a rating that isn't as generous.
We've heard some horrific stories here today and people suffering real life consequences from on-the-job injuries.
Yes.
In your opinion, the proposals in the turnaround agenda would reduce benefits to employees like the folks we've heard today?
Yes, they would. Now, I want to say I'm not unsympathetic to some of the things you've talked about in the medical area. There may be some things that should be done there, although you didn't ask this question, but I'm going to answer it anyhow. I do think concentrating just on fee schedules misses the fact that a lot of the problem in the healthcare area is utilization, and that the states that have tried to only limit medical costs by going for fee schedules, I think often find that doctors just adjust the quantity of care they get. So that I think utilization review, speaking now from the standpoint of the benefit of the system, including from an employer standpoint, just only so far the fee schedules are going to take you, and that we really need to be thinking about other forms of utilization review if you want to get medical costs under control.
Thank you, Professor.
You're welcome.
Chair recognizes Representative Keith Wheeler.
Thank you, Mr. Chairman. Professor Burton, questions for you here.
Sure.
In your analysis of the different states with respect to workers' compensation, is Illinois one of the more generous states when it comes to medical payments made for worker injuries?
In terms of what? In terms of
the medical payments paid out.
Yes, I think it is. Yes, it is.
Okay. You stated earlier that with respect to causation or MCC, that the goal was to ultimately pay out less claims. Is that accurate?
Yes.
I would just beg to differ with your point of view there slightly. Maybe it's out of context, but I think the purpose of a causation standard is to pay out claims for legitimate work injuries and try and drive down those that are not legitimate, or not related to work.
Certainly. I appreciate what you're saying. And obviously the crucial issue is what do we mean by legitimate? And all I can say in the history of workers' compensation, beginning in 1910, 11, 12, the causation standard that has been used in virtually every state is as long as the workplace injury was a non-significant contributor to the resulting disability, then the disability, the whole thing was compensable. So it is taking the traditional workers' compensation standard of causation and making it harder for workers to meet.
Okay. But you're saying that we should take our current version of any contribution to the energy and leave it as it is?
I didn't say that. Any implies that there's, you know, a trivial, non-existent contribution of the trivial. I would say, as I said before, the traditional standard in most states has been as long as the workplace makes a non-trivial or a significant, but not necessarily the most important contribution to the disability, that is what we've been historically finding to be compensable.
Okay, I guess that I'm aware of different companies and different cases where cases were clearly fraudulent, and companies have a whole investigative team trying to find people who are taking advantage and abusing the workers' compensation system. I think causation is a way to address that. Maybe you have a better way to do that.
Well, I think there is a better way to do that. That's to prosecute people who engage in fraud. And, you know, this has been successfully done in a number of states. California would be a leading example of this. If you want to go after fraud, go after fraud.
Okay, but you can still abuse the system without being fraudulent, can you? I mean, there's compensable cases in Illinois where it's the any standard means almost anything related to work. If you're thinking about work, almost, you're going to be able to find a compensable way to do it.
I don't want to get in the box of saying that, you know, these extreme things, any conceivable thing, there's certainly got to be somewhere between any and predominant.
Okay, point taken. Are workers in Florida currently in a situation of dual denial, as you described it earlier?
Yes, they are, as a result of this MCC provision having been adopted in Florida, according to the governor. There's a case that I cited in a footnote, which is a slight variation on dual denial, in which the Florida statute still allowed permanent partial disability benefits, but they were so meager compared to what the law used to be, that the claim was made that even though there was some eligibility left, that constituted such an inadequate compensation that it was unconstitutional to impose that. And the court actually has held that in Florida.
Okay, but in Illinois, currently, civil action is already allowed if workers' compensation is denied. How would causation affect that?
Well, if what you're saying is that the major contributing cause doctrine eliminates, let's say, a case from workers' compensation, that you're willing to allow that worker to bring a tort suit, then fine. But that's not what the states that have adopted dual denial have in general tried to do. They've tried to say, and it's not, you're not eligible for workers' comp, but we're still invoking the exclusive remedy provision so the employee cannot bring a tort suit.
But they already can do that here, now. That's our current law. If a worker is denied workers' compensation, or if they just decide to forego workers' compensation and sue instead, that's allowed.
Okay.
So I don't see how the workers' comp, if we change to a causation standard that's higher than the current any, we would be denying them the civil action they already have entitled to right now.
Well, the question is, are there workers who under the current Illinois law would qualify for workers' comp benefits who would not qualify for workers' compensation benefits under the proposed standard from the governor? And the answer is there have to be some cases, otherwise what's the point of the proposal? And all I'm saying, those cases that are newly uncompensable raise the issue of whether those workers have a right to bring a tort suit. Now, if you're telling me they are having a right to bring a tort suit, then I'm not sure, if I were an employer, I don't think that's what I'd want. I'd rather have them in the workers' comp system than face the possibility of tort suits. But you know the Illinois employers better than I do.
Well, I am one of them. That's why I'm asking the questions. Thank you.
I would just, for the point of clarification, Representative, and for your edification, in Illinois, you can appeal the determination of the commission, but it is an administrative appeal review. It's not a de novo trial. And secondly, you cannot, bring a civil action. Your exclusive remedy is through the workers' compensation system. Representative Flowers.
Well, so long as you get workers' comp benefits, I'm assuming that's correct. But if you no longer can get workers' comp benefits, then at least the general understanding of what this whole provision about is to say you can't bring a tort suit either.
Representative Flowers.
Thank you, Mr. Chairman. Professor, the purpose of workers' compensation is to protect people who were injured on the job.
Yes.
So it is not the purpose to reduce the compensation, it is to protect the workers. Workers' compensation, the purpose of workers' compensation.
Right. Well, let me go back to the historical exchange. If a worker in Illinois was injured in 1909, before the statute was passed here, was injured on the job and could prove that the employer was negligent, then that employee could have gotten a substantial award. Okay. Workers' compensation reduced the potential amount of recovery for a worker. So the worker, as you know, is limited to the amount that's specified in the statute. You cannot, and so it is, in that sense, workers' compensation deliberately reduced the potential recovery. What workers got in exchange for that was they got rid of the negligence test, so that it was much easier to get workers' comp benefits than it was to win tort suit. So that's the historical trade-off. And of course, the issue in the dual denial is, can you do away with one of the side of the historical exchange that is limited, exclusive remedy, I mean, the benefits for the no-fault system, and still maintain the exclusive remedy provision. And I think that's the risk that you take of going down this route.
So that is the risk that the employee takes.
Well, it's the employer who takes that. Because, let me make clear, here, let's assume I'm an employee, and I would have qualified for workers' compensation in Illinois in 2015 under the current law. Okay. The 2016 law is passed, which includes the causation standard recommended by the governor, and I no longer qualify. Okay, so I'm one of those people that is affected by the change in the compensability standard. The question is, do I have a remedy, or can I sue my employer in tort? And all I'm saying is that there are some cases, and Oregon is the leading example in this thing, is if you take away my right that it pre-existed to get a workers' comp claim, you can't also tell me I can't bring a tort suit. That's the dual denial part. And I think there's a real risk that the states that are doing this are going to be facing, and many of them are facing, these challenges as to whether or not the dual denial approach is constitutional.
I agree with you 100% in regards to the dual denial.
Right.
I don't think that should occur. I'm getting back to the point of saving money because of there's the abuse and the fraud. That's one level.
Yes.
So my question to you, have the employers ever thought about on the other end of trying to save money with, as you stated earlier, with the utilization review? That's number one. And as far as the prescription drugs, the cost of prescription drugs. So, and the cost of insurance, period. Have the employers ever thought about trying to save on that part of the level?
I think they have, but I think there's room for considerable additional savings there. And one document that I did not refer in my testimony, something I actually had a chance to read this morning for the first time, the Workers' Compensation Research Institute has looked at what's going on in Illinois, and one of the things they've identified is, if I understand, a physician prescribed pharmaceuticals that are from the physician's own facility. Okay, and one of the things that's happened, and this is happening in a lot of places, is that Some of the drug manufacturers have now repackaged the traditional size of drugs into sizes that have never been used before, and they increase substantially the cost per ounce of these things per gram. And doctors are starting to prescribe this other sizes because they are benefiting personally. So those are the kind of things that I think the whole medical care side is where I would put the energy to, and I agree with employers, there's abuse there. And obviously, this raises a whole other set of conflicts, but that's where I would be going.
Well, and my concern again, and the reason why I started off by asking you what was the purpose of workers' compensation, is because it is supposed to be to protect the injured people and to provide them with some type of wage.
Sure.
But what we're doing here, and according to the statement in your conclusion, that Illinois was successful, appeared to have been successful as far as its intended consequences of lowering the benefits.
Mm-hmm.
So lowering the benefit is not in the best interest of the worker, because he or she still have their families. You've heard the testimony
Yes.
of the people that was here.
Yes.
So it appears to me that the best place to look for the cost savings would be for the utilization review, the cost of the insurance, the cost of the prescription drugs.
Right.
Those issues are not bundled together and negotiated down. And so as a result, it appears to me that the employers allow that side of the ledger to get away scot-free, while he can pick on the workers because of their injuries, or because they didn't know the causation was on the 322nd day, and because it was on the 323rd day that they discovered, they just lose everything. You know, what part does the federal government play in all this as far as protecting the workers because they did not know their rights? Is there any type of causation there to protect the workers?
Well, let me answer a previous question or make a comment before I forget the answer to this one. I think in the cash benefit side or indemnity benefit side, there is a trade-off between benefits and cost. And I don't think there's any way other than obvious fraud, which I don't think is a major problem, but believe me, I'm against fraud. By and large, lower benefits are necessary in order to reduce the cost of cash benefits. Okay. There's no free lunch, as our economists want to say. In the medical area, I think there can be a win-win situation for workers and employers, because I do think utilization review is an important thing. And to a certain extent, there's over-treatment of a lot of cases in workers' compensation, back cases in particular. There's a lot of evidence that that workers tend to get too many operations. Okay. So nobody benefits from that, and I think that's where I would put my energy. Now, on the federal issue, there's really nothing the federal government is doing to look into this issue. In my testimony, you'll see I was involved. I was chairman of the National Commission on State Workers' Compensation Laws.
Mr. Burton, I hate to interrupt you. You got a plane to catch at 5:40. Do you know that?
No, I've missed it long ago.
Oh, you missed it?
Yeah, we're trying to get a flight tomorrow. I gave up on that.
Okay, then keep talking. I was hoping you had a flight to catch.
No, thank you. I appreciate your interest in my flight. I think even right now, Superman wouldn't be making a 5:45 flight. So we're working on getting me out tomorrow. If you see me hanging around the next couple of days, sleeping here in the aisles, you'll know why. I was chairman of a national commission. Okay, the national commission was appointed by the Nixon administration. We happen to have predominantly Republicans. We issued a unanimous report saying there ought to be federal standards for workers' compensation. They have never been enacted. So I think there is a role for the federal government in this area, but realistically, we're not going to see federal standards in workers' compensation, regardless of the merits of those.
Well, would just like to conclude by saying to the doctor, I agree with you. The best thing that we could do to help bring down costs through education, training, and prevention. And with education, training, and prevention on one side, utilization review, lowering the cost of prescription drugs and other things. There's lots of other things that we could do before we start weighing down the workers who may have been permanently damaged as a result of their injury on their jobs. So to me, there's other things that we could do before we start lowering their benefits. Thank you very much.
Thank you. Representative Kay. He's over to the left.
Thank you, Mr. Chairman. Professor, some questions for you, if I may. I'm right here.
I see you now. Yes, it took me a while.
The guy with the white hair.
Not the only one in the room.
You used the term benefits all afternoon as if workers' compensation is a benefit. Is that the way you perceive that, as a benefit?
Yes, I consider it a benefit to workers. As opposed to what? I'm not quite...
Well, as opposed to compensation. We call it workers' compensation, but you referred to benefits all afternoon, and,
okay.
And maybe that's one of the problems that we have here in Illinois, is the definition.
Okay. Well, I don't mean to be too legalistic about it. I'm just thinking, for example, the National Academy of Social Insurance always has tables which show cash benefits and medical benefits.
Fair enough.
I'm just using it in that sense. I know in the insurance industry it's often called indemnity benefits. So I'm just using cash benefits as a general description of it.
Okay, so with that clarification, you certainly don't think that workers' compensation, when filed, should be paid when filed and paid for as much as it's filed and paid for as long as someone requests money. You don't believe that, do you?
No, of course not.
Okay. And you believe that an employer, if there's some sort of negligence or wrongdoing, has a right to challenge that, don't you?
Negligence by the worker?
Well, I mean, let me change the term from negligence and just say if in fact we have a guy with a weight restriction or a lady with some kind of restriction that prohibits her from doing certain job functions,
mm-hmm.
and we find the gentleman pouring a driveway and he's got a weight restriction of 10, 20 pounds, that's not right, is it?
No, that's right.
No, okay.
No, I certainly agree with that general point.
Okay, well, we're headed in the right direction here. So let me ask you a different question here. Did you come here today thinking that Illinois is reducing the rates in Illinois? Is that the perception you had?
Well, no.
Did you have the thought that we were trying to reduce benefits?
Yes.
Really? How is that?
Well, because the experience of those states that have introduced the major contributing cause standard is that many workers no longer qualify for benefits who previously would have. So
well, I understand,
they're reducing
but
benefits.
Here's my problem. Here's my problem. We're in Illinois, and I'm not concerned with what Indiana or Ohio or anyone else does. We're in Illinois.
Good.
Yeah, well, and so I guess where I'm concerned is it seems to me that you're saying, notwithstanding the fact that we're not coming here with any benefit reductions, that you're saying that we really can't change our causation standard without a problem. Is that correct, or am I wrong?
Well, I think you can change your causation standard to the extent we talked about earlier. If it's any, by which I mean trivial contribution from the workplace, I think there's some room there to do some tightening. But the major contributing cause thing goes way beyond that. And the purpose of it has to be to eliminate workers from the system who previously would have qualified. What other purpose is there?
One other question. You seem to have a wealth of knowledge here about a lot of things, and I saw your position paper that you prepared for today. How is it that you came here today? Someone asked you to come, obviously.
Yes.
Who was that?
It was the state AFL-CIO and the applicants' attorneys.
And when did they ask you to come?
3-4 weeks ago.
Okay, very good. Thank you, sir.
let me just add as a little background in terms of my own background. I'm primarily a researcher. The research I'm doing right now is looking at the relationship between workers' comp and the Social Security Disability Insurance Program. It's being funded by the Committee for a Federal Responsible Budget, which is in general known as a bipartisan, slightly conservative organization. So I do not consider myself to be a representative of the union movement, although they asked me to testify today. And if you had asked me, I would have been glad to come at your request. Yes.
Thank you. Representative Batnick.
Thank you, Mr. Speaker. Real quick, Professor Burton, you stated early to the question that Representative Welch stated that if these reforms were enacted, some of the people from Illinois who testified today would have had reduced benefits. Can you cite the case and tell me which person would have reduced benefits?
No, I didn't say that. I didn't say that. I said there are some people who, under the current law, would qualify for workers' compensation benefits who will not qualify for workers' compensation benefits if the compensability standard recommended by the governor is adopted. Now, for those who remain in the system, their benefits will not be reduced. So there's a linguistic question here. When you mean benefit reductions, do you mean benefits for those that get into the system, which will not be reduced, or overall benefits to workers who are injured on the job, which will be reduced?
Okay, well, I believe the specific question was the people who testified today, under the proposal, will they have reduced benefits? If you don't know, that's fine. My understanding was that you said, yes, they would. I'm giving you a chance to clarify here and say you don't know, or if you do know, how much they would be reduced.
I listened to them fairly intensely today, but I don't know because the causation issue, as you know, is a tricky one and depends on the facts of the cases. We didn't get into that a whole lot today. So I don't know the answer to that.
Okay, so to be clear, you don't know if the people who testified today would have a reduction in benefits under the governor's proposal?
Correct.
Thank you.
Representative Kifelwood.
Thank you, Speaker.
Yes.
Right here to your right. I have two questions, and I appreciate your document that you presented to us today. One of the questions that have come to my mind in hearing the testimony is the fact that it seems that it should be in the best interest of us, the state, to ensure that we have both fair and equitable workman's comp, because from what I'm hearing today, is there a correlation with states that have lower, to use the term, benefits or lower compensation with the need of government services of these individuals? Because an individual, I believe from Oklahoma, said he had to go on food stamps, he lost his house, he's in essence relying on more government services than he would have had he been, I guess for lack of a better word, more addressed in his work-related injury. And so has there been any reports or any research in the correlation between government services and those states that have less workman's compensation than states that have more robust workman's compensation?
It's not an area I've done research on. I believe Paul Lee at the University of California, Davis, has written several papers on that, and if I'll try to remember, or you can send me an email, and I'll make sure we send those to you. But the answer, I think what he's found is yes. I can say my own research is that those states that during the 1990s scaled back their workers' comp programs the most are the ones that had the largest number of applications to the Social Security Disability Insurance Program. So there's clearly some cost shifting going on from workers' comp to SSDI as a result of some of these reforms.
So in essence, the government theoretically might see an increase in the need for services.
Right.
And then second, you discussed the major contributing cause. And my question is more hypothetical. If these causes are in effect and say a worker is injured but not to the standard of the MCC standard, what would be their recourse? They would have health benefits up to a certain point, or what would be, I guess, a life in an injured person that isn't injured enough but still significant?
Well, I think that's a complicated question on the medical benefit side, because obviously some employers, but not all, do provide health insurance to their employees. Some persons who don't get coverage through their employer have bought insurance through the Obamacare thing, but there still are a number of uninsured employees in this country, and a lot of those tend to be low-income workers. So for those workers, if they don't qualify for workers' compensation, they're probably not going to have any source of support for medical care other than charity.
So then again, they might have to lean on government services and,
Yeah.
and government subsidy,
Right.
along with overutilization of things like emergency rooms and
Correct.
those kind of things? Okay. Thank you. Thank you both.
Yes?
Well, thank you. Seeing no further members seeking recognition, we will move to the next panel. Christine Fuller, whose father was killed on the job in Illinois, and Mr. Corden.
I think at this point it's fair to say good evening. So I promise to speak quickly. As long as you respect my time, I will respect yours. So I will start off by reading what I was asked to prepare. So,
Christine, I'm sorry. If we could have everyone's attention, please, everyone's attention, please. Thank you.
thank you. My name is Christine Fuller, and I traveled here this morning from my home in Hobart, Indiana. I'm a club director of a Boys and Girls Club in Indiana, one of my life goals that I would not have been able to accomplish if it weren't for the workman's compensation I received under Illinois law as a result of injuries my father received resulting in his death while working in Elgin, Illinois. My dad was Edward Zanicki, and I am told we were a lot alike. My dad and I weren't very close when I was growing up. I was a product of young parents who tried marriage and eventually realized they were too young to make it work. I didn't spend a lot of quality time with my dad, a weekend here or there, but it was a time I look back on and cherish. We spent a lot of time arguing. Like I said, we were a lot alike, too much alike to get along. And when I say too much alike, I really mean we were stubborn. That all changed when I entered high school. All of a sudden, he was an involved dad, wanted to pick me up from school on Fridays, spend time with me. He even volunteered to help build the set of a high school play I had been cast in. I think we were both maturing enough to realize that we could get along and actually enjoy each other's company. That time was cut short on November 21st, 2001, the day before Thanksgiving. I remember answering the phone and the woman on the other line asking, "Are you a relative of Edward Zanicki?" I instantly handed the phone to my grandma and told her it was from her, or for her. All I remember of that god-awful long drive to the hospital was holding my grandma's hand and telling her it would be all right. My dad was gone before we got there. No last rites, no goodbyes, just a doctor saying he's gone. We were told he fell 15 feet onto concrete while working on a roof and died as a result of the injuries he sustained. Because he had died on the job, we were informed I would receive 2 checks a month until I turned 18, and if I remained a full-time student, the benefits would continue until I turned 25. It may not seem like a lot to those who have had the fortune of never receiving workman's compensation benefits, but my story is a little more complex. You need more context about me to fully understand how I have benefited from those 2 checks in the mail every month. Even though I was receiving workman's compensation every 2 weeks, I did not feel as though I had won some kind of personal injury lottery. All I wanted from the time my dad died was my mom and her support. However, my mom didn't handle my dad's death well. Divorced or not, he was still a significant person in her life. And to say didn't handle it well doesn't do it justice. While grieving over the loss of my dad, my mom got involved with drugs and the wrong type of people. Because she couldn't hold down a job, steady income was a thing of the past. There were times when I wasn't sure if we would be able to stay in our house or if we would have to move in with my grandparents or I would have to change schools. There were times when I would have to drive to the gas station at night in order to brush my teeth because the water bill wasn't paid, or read more because we didn't have the money for the electric bill. My grandparents were able to utilize the money we were receiving from workman's compensation to continue to pay our mortgage because my mom was unable to function as a parent at that time. We were able to keep our house, and I was able to stay at my school with my friends. This was a rough time in my life. I believe the workman's compensation I received helped my family as we went through one of the worst times and allowed us to stay where we were and meet our most basic needs. Thankfully, my mom eventually did get her life together again. When I turned 18, I was accepted to Purdue University and gladly made my way down there. I was able to utilize the benefits I was still receiving to pay my rent and books while continuing to help my mom when I could. The money I received helped me obtain my bachelor's degree in early intervention, very close to graduating with honors if I had only taken that freshman math class a little more seriously. With my diploma in hand, I moved on to achieve another goal of mine, graduate school. I made the decision to go directly to graduate school because I would continue receiving workman's compensation, which would help pay for school and to achieve my ultimate career goal of nonprofit management. I also knew it was something that would make my dad, who was barely a high school graduate himself, proud. As I attended graduate school full-time, I was living with my husband and working part-time as a waitress. The workman's compensation I received every 2 weeks were a godsend because they allowed me to focus on my education and not to have to worry about how the mortgage was going to be paid for that month. I was able to graduate with a master's degree in human development, not with no debt, but significantly less than I would have had if I did not receive those benefits. It's because I was able to focus on my education rather than how I was going to pay bills, I can proudly say I am the club director. This is something I am 100% sure would not have happened if it weren't for Illinois' workman's compensation law. I don't know where I would be or what would have happened without the benefits I received, but I am grateful for what I did receive. The benefits were not squandered or taken advantage of. They were put to good use. In no way do they replace my father, who I think of every day, but I can go to work and hold my head high because I know he is in heaven looking down saying, "Way to go, Christine." This was all possible because of the workman's compensation I received every 2 weeks until I turned 25. My sister Samantha didn't have the chance to get to know our dad because she was only 7 when he died. She doesn't remember much about him or the grieving process we went through. She doesn't remember his laugh, his smile, or any special times that were spent together. Our father lives on only in the stories that people tell her and the pictures on her walls. She will be 21 in September and is pursuing a degree in nursing. Because Illinois law allows her to continue receiving benefits until she is either no longer a full-time student or turns 25, Samantha can afford to pursue a degree and become an even more productive member of society. This wouldn't have been possible had our father been killed in our home state of Indiana. Because Indiana limits its death benefits paid to surviving children to a maximum of only 500 weeks, and due to Samantha's age when our father died, her benefits would have been cut off shortly before she turned 17. She would not be able to afford to go to college. Rather than earning the wages that a college degree pays, she would be earning the wages a high school degree pays. If my father's accident had happened in Indiana, my benefits would have stopped when I turned 21, and I would not have been able to afford graduate school. If they did stop, management would have been impossible with only my bachelor's degree. No amount of money will bring back our father or take the place of the memories we never had the chance to make, but there is peace of mind knowing the state of Illinois helped us for the past 14 years with a life-changing piece of paper every 2 weeks. I can say for certain the benefits I received helped me in a positive way and continues to help my younger sister. Thank you.
Mr. Corden.
Thank you. As Christine adequately and accurately indicated, Indiana has a cap of 500 weeks of death benefits to be divided between the surviving spouse and the dependents. If the surviving spouse has a right to it, automatic right for 2 years, and irrespective of whether or not the surviving spouse remarries, upon remarriage they terminate and the balance of those benefits are divided between the children. The children are those children to whom the decedent owed a duty of support at the time of death. And as she accurately stated, they end at the age of 21 or after 500 weeks, whichever comes first. Thank you.
Representative Williams.
Thank you. I'm over here to your right. First of all, my deepest sympathies on the loss of your father. Also, thank you for the work you're doing on behalf of the Boys and Girls Club. That's so important in these times, so congratulations on that. We've heard a lot from the injured workers today, but this is the first time we've heard from the surviving family, so I think it presents a helpful perspective. Thinking back, you know, obviously you've said how important these benefits were to you and your family. What do you think the repercussions would have been had you not had that opportunity? We've heard a lot about, having to deal with, go on some public assistance programs, problems keeping the house. Were those things that you were going to be faced with the loss of a breadwinner?
Yes. I mean, like I said, without it, we wouldn't have been able to keep our house. I probably wouldn't have gone away to college. I wouldn't be where I am today. Graduate school would have been out of the question. My career now would have been absolutely out of reach.
Okay. So in terms of education, higher education, both you and your sister were impacted by the workers' comp benefits.
Yes.
Otherwise, were there other options? Did you have other avenues for income for your family at all? Or?
No. For school, no, it would have just been loans.
Okay. Well, again, my deepest sympathies are lost your dad, and thank you for sharing your story with us today.
Representative Monique Davis.
Thank you, Mr. Speaker. Here I am, Christine Fuller?
Yes.
Okay. You know, you say you went back, you continued with your education, and you have a bachelor's degree in?
Early intervention.
And so are you working in that field now?
Yes, I'm the director
Okay.
of the Boys
But
and
had
Girls
you
Club.
not been able to get those dollars, you would have been maybe a waitress?
That's, yes.
You wouldn't have been able to earn what you're earning today and successfully take care of yourself?
No.
And how's your little sister doing?
She's doing fine. She's working, and the benefits and help her to pay her tuition and her books and her apartment.
So in other words, by us, or I should say the state of Illinois, giving you the opportunity to develop skills so that you could become self-sufficient, we have saved money in the long run.
Yes.
And I'm awful sorry about your dad, and I commend you for your strength and courage and your education. Thank you.
Thank you. Representative Reeves Harris.
Thank you, Chair. This question is for Mr. Corden. You may or may not be able to answer this question, but if Illinois were to go to the primary cause standard, would she have been, and it was determined that there was some fault of her father, would she be entitled to the benefits that she received?
I think those two are really two independent theories. The fault concept is, as far as I know, during the discussions with Mr. Burton, there was no discussion about fault on the part of the employee. My understanding is the act that you're talking about would still remain a no-fault act, so that would not be part of it. As I understand what happened to her father, it was certainly the major contributing factor to his death was the employment, the falling off the ladder, or whatever that was. So I don't think her situation would have changed as far as the compensation paid to her as a result of that death of her father.
Okay, thank you.
Christine, I just want to say that I certainly understand where you come from. In 1983, I was in college, and I was playing baseball in college, and actually my baseball coach pulled me aside after a doubleheader and told me my dad had been killed in a trench cave-in. Well, I don't talk about that much, but I understand it. And I'll never forget that ride home from Bloomington, Illinois to Highland, Illinois. It was the worst and most painful experience of my life, only topped by walking in the front door and seeing my mother. So I've been there, and we survived, but every day we miss him, and I miss my dad every day. So God bless you. Two more questions. Representative Fine.
Thank you, and thank you for coming here today and sharing your story. I think one thing that we haven't really touched on is financially, this was able to help you get through. But the side of the story that I'm wondering about is emotionally, how would have you been able to handle the strain of not only your father's death, but of trying to get through every day? What kind of strain would this have put on your family?
I don't like to think about it. I don't know. I honestly don't. That was one of the worst times of my life, and I mean, I remember contemplating suicide at one point just because it was so bad, and that was with it. So without it, I don't know, but if I'd be here.
Thank you, because I think one thing that we really have to focus on too and think about is financially this might be able to pay the medical bills and to help you, a family financially, but emotionally it's a big life change, any of these accidents, especially a death in the family. And to have something to help ease the blow can really make the difference between a life of devastation and able to figure out how to move on. So thank you for sharing with us.
Representative Yingling.
Well, thank you very much for coming today. We really appreciate you sharing your story, your very personal story with us. Can you tell us how much you got 2 checks a month? Is that right? How much were each one of those checks?
$790.
Okay, so you got, all right, like a little over $1,500. Okay, each month, and that was just for you, or did your sister also get some sort of compensation as well?
She got, as far as I understand it, she gets the same amount.
She does, okay. And then what about your mother? Did she also, I know your parents were divorced, but did
No.
she get anything else? It was just you and your sister?
Yeah.
Okay, great. Thank you very much, and thanks for coming.
Representative Reeves Harris.
I'm not sure if maybe I didn't ask the question correctly, and maybe that's because I'm still confused. Is currently, right now, Illinois a no-fault state, is that correct?
Yes.
And so under this current scenario, she was entitled to the benefits. And again, I'm sorry for your loss, and thank you for coming and share your story. But my question is, if Illinois were to go to a primary cost state, and it was determined that he was at least 50% at fault, she would not have been entitled to any of the benefits. Is that correct?
The idea of fault is a defense to his actions, for instance, like intoxication is a fault, and there's certain specific defenses within your act that would even today bar him from any or in this case her, from any compensation. And the major contributing factor is what caused the accident in the first place.
So there is a determination of, again, I thought Illinois is a no-fault state, and it's just from my understanding. I thought Illinois was a no-fault state.
It is a no-fault state.
So
they,
in order for her to, I'm sorry.
When you say no fault, it doesn't mean you can do anything in the world. It sort of talks about negligence. If you're negligent, that's not a factor in barring you from compensation. You can't, here's an example, you can't get intoxicated and go on the job and get hurt and expect to get compensation, or you can't shoot yourself, you know, with a hammer gun or whatever it may be and expect to get compensation. So there's,
well, let's not go that extreme, but let's,
it's intentional
acts.
Right.
So assuming short of it being an intentional act,
then it's a no-fault state.
And so it's a no-fault standard.
Correct.
But in that same scenario, if it was a non-intentional act and we went to the primary cause, but it was a non-intentional act, and he still had at least 50% of the primary cause, would she be entitled to the same benefits?
It would appear from what I listened to today that there would be no compensation paid.
Okay. Thank you.
Thank you. Thank you, Christine. Yeah. Thank you. Yeah. Be safe. The last panel, we're combining panels, is my understanding. Will be Terry Robinson, the National Council on Compensation Insurance, Steve Schneider, American Insurance Association, Dave Manchetti, Cullen, Haskins, Nicholson, and Manchetti, Kim Janis of the Illinois State Medical Society, and A.J. Wilhelmy of the Illinois Hospital Society.